Before we jump in, I want to note that this webinar will cover information that is specific to Continuum of Care program and Emergency Solutions Grant program funding. We won't be covering the HOPWA waivers that HUD announced at the same time, and the waivers that we're covering do not apply to any other federal funding streams such as SSVF, HOME, etc. So this is really very specific to COC and ESG programs. We are recording this webinar so that it's available to you and to any colleagues who couldn't attend, and we'll be sending out the slides, so you'll have access to the slides after the webinar as well. We are going to keep everyone muted throughout this webinar, but we'll be using the Zoom chat box to take your questions. For the sake of time and clarity, though, we are going to keep everyone muted with your microphones. Okay, so it looks like we have a good group already joined, so we're going to dive in to the agenda for today. I want to introduce your presenters, of course. So my name is Eli Hamilton, and I'm with Home Base. My colleague Monica and I will both be presenting today.
Good morning, everyone.
Home Base is a nonprofit. We're based in San Francisco, and we work with homeless systems of care across the Bay Area, other places in California, and nationally. In Santa Clara County, we work with the County Office of Supportive Housing to provide an annual series of free trainings for providers of homeless housing and services. We also help the community apply for federal COC funding, and we generally support grantees with grant compliance throughout the year. So we're here for you, and it's really great to see a bunch of familiar names from our trainings and our work in the county. And I really look forward to the day when we could see all of your faces again. So today we're going to start with some background information that applies to all of the COVID-19 related waivers. Then we're going to cover the 7 COC waivers individually, and we'll be covering the 3 ESG waivers that are relevant to you all as providers. As I mentioned, we'll be using the chat box to take your questions throughout. So as you have questions, as they come up, please type them into the group chat. One of us will be monitoring that. So go ahead and find that chat now in your Zoom controls. We'll give you a bit while I talk about the intro stuff to do that. And as you have questions, type them in. To make sure that we can cover everything and stay on time, we might not be able to answer all of your questions in the webinar itself. So we are going to try to pause periodically to track questions and to answer as many as we can. But any questions that we can't answer, either because of time or potentially because we just don't have that information yet, we'll do our best to follow up as soon as we can with a written FAQ or some follow-up emails. So we will be keeping all of the questions that you ask. If it's not answered, we will do our very best to answer it later. So we're going to jump into the background and context for what we're doing. On March 31st, HUD issued a memorandum that made available a set of waivers that temporarily allow programs to set aside some specific statutory or regulatory requirements of the COC and ESG funding requirements. The goal and the purpose behind these waivers is specifically to prevent the spread of COVID-19 and to mitigate its economic impacts on our communities. It's important to note that goal, and we're going to come back to that a couple times throughout the presentation, because as you're using these waivers, you will need to demonstrate to HUD or to track and document that it is necessary for you to use the waivers in order to accomplish this goal of keeping people safe, preventing the spread of COVID-19, and mitigating its economic impacts. So we will be coming back to that language. In order to make sure that our community is complying with all of the regulatory requirements that we need to meet in order to maintain this funding, and to make sure that we're implementing these waivers as quickly and as easily as possible, the COC has established some written policies and procedures that govern how to use these waivers. So the COC has a set of policies and procedures in place called the Quality Assurance Standards, and these govern COC and ESG grants all the time. There are COC written standards for providing assistance. For this case of these COVID-19 waivers, which will be temporary, we've drafted up an addendum to the QAS that will walk through each of the waivers, how to use them, and what the documentation standards are. The information we're presenting in this webinar is based on HUD guidance that's come out about the waivers, and it is very closely aligned to what's in the Quality Assurance Standards addendum about the waivers. But we do encourage you to read that addendum and look at it, particularly if you're responsible for establishing your agency's own policies and procedures for using these waivers. So there are a few things that you need to know and do before using any of the waivers that we're going to talk about. The first thing is that your agency needs to have notified the local field office that you intend to use a waiver at least 2 days before you actually plan to use it. I know most of our COC and ESG grantees have probably already done this, but you do want to make sure that someone at your agency has sent in this notification. There's a notification template provided by HUD that makes it really easy to do. We just want to note that once you do that, you definitely want to keep a copy of the notification that you sent in for your records. That includes both the form that you filled out and sent to HUD, and also the enclosing email for that form so that you can have a record of the date that you notified HUD. As always, for record keeping, this is in case of a future monitoring by HUD, so you can document why you were able to waive some of these grant requirements. You also definitely want to establish internal policies and procedures for your organization. This is something that HUD has called out specifically, that recipients are expected to maintain written policies and procedures that will govern which waivers you're going to be using, and also the conditions under which you will be using those waivers. So when is your agency going to determine that it is necessary to use a waiver? And that really needs to be written into your policies and procedures, at least temporarily. We strongly, strongly recommend, again, that you take a look at the QAS addendum. A lot of the stuff that's in the QAS addendum, you'll probably be able to just copy and paste into your own written policies and procedures. And even if you have to do some adjustment, it's a really good place to start. It'll lay out the documentation and record keeping requirements that the COC has put in place, et cetera. And then finally, for every waiver that you use, every time you use the waiver, you have to document that you've used it, and you have to document why you used it in this particular case. And piece is that it has to include a justification for using the waiver. So why is it necessary for you to use the waiver for this particular client in this particular situation in order to accomplish HUD's goals and to sort of align with HUD's justification for providing the waivers? Generally speaking, that is when it's necessary to keep people safe, to prevent the spread of COVID-19, or to mitigate the economic impacts of COVID-19. In terms of what that looks like for each individual waiver, we'll talk a little bit more about that when we get into the waivers themselves, but some examples are as a result of either illness because of COVID-19 or staff who are particularly vulnerable to the virus. We have limited staffing, and therefore we can't do a monthly case management meeting with every client. That is something that an example that HUD has given. So limited staffing could be a reason that you need to waive some of the regulatory requirements. Not being able to meet in person because it's not safe, because it's not compliant with public health guidance at the time, because it's really important right now for people in our specific community to be housed and to not be on the street in order to prevent the spread of COVID-19. So some of these requirements allow you to get people into housing faster. Whatever your justification is, make sure you're tying it to our local situation. HUD wants to see that you're looking at the public guidance that's in place in Santa Clara County and in the Bay Area, and also looking at your client's specific circumstances. So it's probably not going to be enough to have stock language that just refers to the COVID-19 pandemic existing. It needs to be a specific justification each time you use it. In order to help you out with this, we've provided some forms. We've created some forms. There's one form for each waiver, and that form will sort of walk you through how you, it should be an adequate documentation of this. So if you fill out this form and you're thinking about that, what I've said about the justification, you should just be able to include that form in the client file, and that should document your use. We'll show you a couple of examples of those forms as we go through the waivers. So I want to pause here before we jump into the COC waivers themselves. It looks like we have one question in the chat box. So when we say QAS policies and procedures for the COC, do you mean those are specific to Santa Clara County and not other counties? Yes. So the quality assurance standards I was talking about are the Santa Clara County COC written standards. Every COC is going to have their own written standards. That's a requirement of receiving the COC funding. So if you are working in multiple COCs, you may want to reach out to the COCs in other areas that you're working with and just ask if they have written policies and procedures for this in place or not. It's a great question. Okay, so I don't see any other questions in the chat. So we're going to jump into some of the waivers that apply to the COC program specifically. Now, this is a place where if you're here for ESG funding, we're going to get to you in a bit. We're going to cover the COC waivers first. I want to make it really clear that these waivers do not apply to ESG funding. And so if you are here for ESG, I welcome and encourage you to listen along and to keep your attention on the webinar, because a lot of the stuff is pretty parallel, but just know that this information is not specifically for your grants and your programs. There are 7 waivers available for the COC program, and we're going to go over each of them. So the first waiver is a waiver of the FMR requirement, the fair market rent requirement, for projects that get leasing dollars only. So this only applies to projects that get leasing dollars. In general, if you have leasing funding under the COC program, you can't pay above fair market rent for any particular unit. The waiver that HUD's made available says that in some cases, you may be able to pay above fair market rent out of your leasing dollars, as long as that lease was executed in the window between March 31st and September 30th. So really the date of the lease execution is what's relevant here, and that needs to happen in this 6-month window. The reason that this only applies to leasing programs is that if you have rental assistance funding, you can actually always pay above fair market rent. That's not the regulations about leasing and rental assistance are a little bit different. I want to note that while, yes, you can pay above fair market rent with your leasing dollars, as rental assistance grantees know, that doesn't mean you get extra money. So you definitely want to keep a close eye on your budget if you're going to be implementing this waiver, to make sure that you're going to have the money to keep paying above FMR to support that unit. You will be able to pay above FMR for as long as that lease is in effect. And HUD has indicated that an extension of an initial lease, so an automatically renewed lease, they're going to consider that a continuation of the initial lease. So really, for as long as you have control of that property under that lease, you're going to be able to keep paying above FMR. That's one of the reasons it's so important to document the use of these waivers. Because if you're leasing this unit for the next 2 years, 3 years, 10 years, at some point, it's very likely HUD is going to come in and monitor that program And they're gonna very likely notice that something is a little weird about this unit, that you're paying above FMR. And that's why you really need to be able to show them, yep, we're paying above FMR, it's not usually okay, but remember back in 2020, we had this COVID-19 pandemic that was really, really challenging and really horrible. And you all said that we could waive this requirement. In order to sort of backstop that and make sure that you have the documentation in place that you need, we're recommending, and it's in the quality assurance standards addendum, that you have to have in the client file, of course, a copy of the lease with the date that it was executed. This is something that you should always have in the client file, but the key point here is the date of execution there needs to be in that 6-month window from March 31st to September 30th. You need to have a completed rent reasonableness analysis, because the FMR requirement is waived, but the rent reasonableness requirement is not waived. So you still have to make sure that the units that you're leasing with these COC dollars are rent reasonable. And then you want to have that note to file. You want to have, ideally, I think using the forms that we've provided, documentation, and just a note that we use this, this waiver. This is why we use the waiver. We definitely did notify you we were going to use the waiver. It's all good. I'm going to pull up and show you the form that we've have provided or are going to provide for you all as a sample or a guide or an actual form that you can use. So we have provided, as I said, a form specific to each of the waivers. So this one is specifically for the waiver of FMR for leasing projects. There's some language up here that is mostly aimed at HUD so that we can remind that future HUD monitor of what was going on during this time and of the memo that made these waivers available. It outlines what the waiver is generally, and then it has a set of instructions for whoever is filling out the form. The instructions are just going to tell you, remind you to complete all the parts of the form. So in this case, that means the documentation checklist, and then a section called justification for use of waiver. And then it will remind you that you do need to put this form into the client's file. The documentation checklist piece is going to make sure that you're identifying this waiver usage with a particular client. And in this case, because it's about leasing a unit, with the address of the unit, so you can tie that to other stuff that you have in the client file. Reminding you that you want a copy of that lease, that you want a completed rent reasonableness analysis. We encourage you to use this checklist. We know that you all are very busy, especially at this time. So this checklist can help you make sure that you are keeping those client files complete and clean. And then the justification for use of waiver section. This is where you're going to explain why it was necessary to waive this particular grant requirement for this particular client. And we've prompted you here that this should really be focused on why it was necessary to pay above FMR in order to quickly locate and move this client into housing. The explanation should be specific to the client's situation. You can reference things like the housing market right now and public health guidance saying that it's really important for people to be able to be inside. I think all of that is in place. And you just want to explain to HUD, look, this is what we're dealing with right now for this particular client or in our community right now that makes it really important to get people into housing quickly. And then we couldn't get this person into housing quickly unless we were able to pay above FMR. We couldn't find a unit that was for lower than FMR that was big enough for this client or was appropriate for this client. So those are the types of things you need to be documenting in your justification and your reasoning. Okay, so that's our first waiver. We're going to go over waiver number 2. Waiver number 2 has to do with disability documentation for programs that require a disability as an eligibility criteria. So primarily permanent supportive housing. Generally, all PSH participants have to have a documented qualifying disability. Generally, that documentation must be third-party documentation. It needs to be provided by someone who is licensed by the state of California to both diagnose and treat the condition that is being documented. And it needs to document that the client specifically meets HUD's definition of disability. They're under normal circumstances, so generally, there is sort of a little bit of leeway where an intake worker, a program staff person can observe and say, based on my observation, based on my professional judgment, this client does have a qualifying disability. But then you have to follow up within 45 days in order to get that third-party documentation. So that's normal disability documentation world. And to the extent that that is possible to keep doing, without undue burden, if it's actually really easy for you to get this documentation still, you should keep doing that and keep trying to get the third-party documentation. But HUD recognizes that that's not going to be possible in a lot of cases at this point, because we can't have our clients in a lot of cases going in to see medical professionals right now. So this waiver provides a waiver of the third-party evidence requirement. You have two options for documenting disability if you can't get that third-party certification from a medical professional. You can do an intake staff or a program staff observation of the disability. You do need to record that. You need to write it down. We're waiting for more information from HUD about what that recorded observation needs to include, what that needs to look like. And we'll get that information to you as soon as we have it. But the key change here is that you can observe that a client has a qualifying disability, and you can record that observation. And as long as the client has an entry date into the program, an enrollment date into the program in that 3-month window from March 31st to September 30th, you do not need to follow up and get third-party sort of certification from a medical professional ever at any point for this client. Just the staff intake observation is enough. The other option here is to have the client self-certify that they have a qualifying condition or a qualifying disability. We have a form for that self-certification already put together that I'm going to switch to, and I want to call out that the time frame that self-certification is allowed is a little bit different. So you can use intake staff observation in that 6-month window. You can use self-certification until public health officials determine that no additional special measures are needed in this area. So really until the public health guidance changes in such a way that you no longer need to use self-certification. HUD doesn't get any more specific than that. They want it to be a really local thing specific to our situation. So one of the things that the COC will do is to sort of track when we think the need for self-certification is winding down and try to communicate that to folks. So just know that you have two options. Either one works. There's a slightly different time frame for when these options are available to you. This is the form that we've put together to document a self-certification of disability by a client for a COC program. Again, they have that background in there. This language is mostly for HUD to remind them what's going on. We have some instructions. The instructions here will prompt you to complete the justification section. It's very important, don't forget about that. And to work with the client to complete the self-certification of disability section. For the justification section, the key here is to make sure you're describing your efforts to get that third-party documentation. Whatever you can do to just try to get third-party documentation of a disability until it doesn't work, until you can't. Say you call up a doctor or a psychologist or a psychiatrist who has been working with your client and say, hey, can you, this is HUD's definition of disability. This is the form that we use to document that. Could you fill this out and scan it back to us? Or could you just certify to these things in an email? And the medical professional says, sure, I can do that. And they get back to you. That's great. Then you have third-party documentation. If you do that, you reach out and you don't hear back from the doctor, or the doctor says, or the LMFT or whoever says, I can't do this right now. I don't have access to my records. I can't go into the office. I am, or maybe they don't respond. If it's impossible to obtain that, or maybe because your client doesn't have a diagnosis yet and they need one, but they can't get in to see a medical professional right now because very few of us can for reasons other than COVID-19. Those are some reasons that you want to explain here. Look, I tried to get third-party documentation. I couldn't get it. I took these steps, and this is why I wasn't able to get it. And then you want to definitely sign that is the case. And then at that point, you can move to the self-certification of disability with the client. This self-certification of disability includes the three options. These are the three options for a qualifying disabling condition. Either a long-term disability that's going to impact the client's ability to maintain housing, or a developmental disability as it meets HUD's definition, or an HIV or AIDS diagnosis. Any one of these three is a qualifying disability. You'll note that this is a self-certification form meant to be used by a client, and despite that, we have used language that is very close to HUD's language in the regulations, which is not client-friendly because it's not person-friendly. So we really are going to be relying on staff working with clients to walk them through this form, explain why we're needing to collect it, what each of these three categories means, and to work with the client to figure out which one they feel comfortable self-certifying about for themselves. For this piece of the self-certification, you actually have a couple of options. The client, if it's possible, if you can email this form to the client and they have the ability to fill it out and send it back to you, either they'll need to be able to print it out and sign it, unless they have an e-signature, which I certainly don't have. And then they'll need to be able to scan it back to you with that signature visible and one of those boxes checked, or take a photograph of it and send it back to you with the signature. Any of those options work. If that's not possible for your client because maybe you can't, they can't print it out, they can't scan it, they can't photograph it, it's also okay for them to just send you an email that has this information in it. So to do that, you would again talk to them about these three definitions of disability, and they would it would be very much best if they could take this specific language and put it into an email in some way. The self-certification, it's tricky because anytime you're having someone try to work with federal regulations, it's tricky. But we do recommend that the email from a client has language that matches and very clearly meets HUD's definition of disability. So one way to do that is to talk them through, like, this is the statements that you should make in the email. Can you put that in an email and send it to me? So that's maybe an option for some clients. And then you want to print out that email and put it in the client file as your documentation. If neither of those are possible, as a last resort, you can fill out this form based on an oral certification from the client. If you're going to be doing that, you need to, again, talk to the client, talk them through. So this is why we're asking you to do this. This is what the possible qualifying definitions of disability are. Which one of these do you think is you're comfortable self-certifying to? And you can check one of these boxes. You can fill out this part of the form. Then you want to make sure you check this box that says, I am a program staff who is filling out the form on behalf of a client. And then you're going to put your name and you're going to sign to certify that you did indeed take this oral statement. So HUD's provided a number of different options, doing their best to lower barriers to getting people into programs. The oral self-certification, where they tell you and you're filling out this form, that should be a last resort. You should only use it if you're not able to have the client self-certify in writing themselves. But if they can't do that and they're not able to because of technology or the ability to process the written form, that should not keep them from being eligible and enrolling in a program. So that's the important part. Okay. So we've gone over the first two COC waivers, and I'm going to pass over to Monica for the next few, but I want to make sure that there are no outstanding questions. So if you have a question, go ahead and make sure you're typing it into that chat box. I don't see any at the moment. Okay. Monica, over to you.
Great, thanks, Eli. And can you all hear me all right?
Yep.
Great, thank you. So the third COC program waiver that we are going to go over today is regarding the limit on eligible housing search and counseling services. So generally, COC program supportive services funds may not be used for costs of utility or rent arrears. Typically, housing search and counseling services funds are limited to those costs that are listed in the interim rule. However, HUD's memo waives the limitation on eligible housing search and counseling activities. Under this waiver, COC program supportive services funds may be used for up to 6 months of a program participant's utility arrears and up to 6 months of rent arrears, when those arrears make it difficult to obtain housing. And that's an important piece that we'll touch on, particularly with respect to documentation. This waiver is in effect for 1 year, starting March 31st, 2020, and going until March 31st of 2021. Next slide, please. Each time this waiver is applied, programs need to document it, as Eli went over. In this case, for this waiver, that documentation means documenting the client's inability to obtain housing as a direct result of rent and utility arrears. And what do we mean by that? An example of that would be written notice, for example, from a landlord or a property manager that the landlord has rejected or will reject a client's application due to rental or utility arrears. And that connection does need to be made in terms of the cause. Additionally, as Eli noted, and with all of these waivers, there needs to be documentation of using the waiver. So that means a note to the file with the date of HUD's waiver memo, the waiver being applied and the date of use, and a detailed justification for its application to this client's lease. Again, the COC has provided or will provide forms for this purpose. We're going to go ahead, though, and jam on to the next waiver unless there are questions. Okay. The next waiver for the COC programs is regarding case management. Generally, recipients must require rapid rehousing program participants to meet with a case manager at least monthly. However, as we've noted, due to staffing as well as public safety considerations, that's not possible regarding COVID-19. So HUD's memo waives this monthly case management meeting requirement for 2 months, beginning on March 31st, 2020. However, as a result of COVID-19 and the public health response, many clients may be particularly in need of support during this time. And so providers, and we recognize that providers are incredibly busy at this time, should try to make every effort to maintain regular contact and case management with clients as much as possible over the phone or video or through other means that would maintain the safety of both clients and staff. So as I mentioned, this waiver is for 2 months from March 31st until the end of this month, May 2020. And again, each time this waiver is applied, programs need to maintain a note to the file with the date of HUD's waiver memo, the waiver being applied and the date of use, and a detailed justification for its application to this client's lease. And again, the COC will be providing a form for this purpose. The next COC program waiver is regarding housing quality standards. There are two COC program waivers regarding housing quality standards, and the first one, this one, is regarding initial physical inspection of a unit. Generally, recipients are required to physically inspect any unit supported with leasing or rental assistance funds to assure that the unit meets housing quality standards before any assistance will be provided on behalf of a program participant. However, recognizing that in-person meetings are particularly challenging and indeed sometimes not advisable at this time, HUD's memo waives the initial physical inspection requirement for 6 months, beginning March 31st, 2020. Programs using this waiver must instead visually inspect the unit using technology such as video or photographs to ensure that the unit meets HQS before any assistance is provided, and to have written policies to physically re-inspect the unit within 3 months after health officials determine special measures to prevent the spread of COVID-19 are no longer necessary. Again, this waiver regarding the initial physical inspection of a unit for HQS is in effect for 6 months from March 31st until September 30th, 2020. Each time this waiver is applied, programs need to maintain the following documentation. First, a completed HQS inspection form noting the method of observation. Second, a recording or copies of the video or photographic inspection, which must include date stamps within the waiver timeframe. And it would be a good idea to have video or photographs of each of the different rooms or each of the different parts of the unit that need to be inspected for a complete HQS inspection form. And finally, again, a note to the file with the date of HUD's waiver memo, the waiver being applied and the date of use, and a detailed justification for its application to this client's lease. The second COC program waiver regarding housing quality standards is regarding re-inspection of units. Generally, recipients or subrecipients need to inspect all units for which leasing or rental assistance funds are used at least annually to ensure that they continue to meet housing quality standards. HUD's memo waives the reinspection requirement for 1 year, beginning March 31st, 2020. However, again, as much as possible, programs are encouraged to maintain regular contact with residents, including regarding any housing quality issues that may arise in the time being. So again, this waiver is in effect for 1 year from March 31st, 2020 until March 31st, 2021. And at risk of sounding like a broken record, again, the documentation that's required is that note to the file, the date of the HUD waiver memo, date and which waiver was applied to this client, and a detailed justification for doing so. The final COC program waiver that we are going to cover today is regarding the 1-year lease requirement. Generally, program participants residing in permanent housing must be the tenant on a lease for a term of at least 1 year that is renewable and terminable for cause. HUD's memo waives the 1-year lease requirement for leases signed between March 31st and September 30th, 2020. The initial lease term for these leases must be for at least 1 month. So this waiver applies to rapid rehousing or permanent supportive housing program participants who enter into an initial lease with a start date that falls anytime in that 6-month period, March 31st until September 30th, 2020. For those program participants, the lease does not need to be for 1 year, and it can be for as little as 1 month. Keep in mind, this waiver provision only applies to program participants entering into their initial leases and not to those who were already leased up as of March 31st, 2020. Also, these program participants would not be required to sign a 1-year lease once the waiver period is over. So again, this waiver on the next slide, please, is in effect for 6 months from March 31st to September 30th, 2020. And each time this waiver is applied, programs need to maintain a copy of the lease that clearly displays the date of execution as being within that 6-month time frame, and including an initial term and automatic renewal. And again, to have a note to the file with the date of HUD's waiver memo, the date in which waiver was applied, and detailed justification for applying that waiver. Thank you so much for your attention on these. I'm going to turn it back to Eli for our ESG waiver overview.
Awesome. Thanks, Monica. I'm still not seeing questions coming into the chat, so I think I can safely say that was an excellent and clear explanation. I want to note on this 1-year lease requirement waiver, the lease that you signed can be for less than a year. It can be for as little as 1 month, but of course it still does have to have all of those typical COC lease requirements. Aside from that, it needs to automatically renew with no prior sort of conditions. It needs to have all of the Violence Against Women Act related requirements and terms and addendums in it. So all of the other lease requirements that normally apply still apply. It's just the initial term of the lease can be shorter. All right, moving on to our 3 ESG waivers that we're going to go over today. So you ESG program folks, this is your time. There are 3 waivers that we're going to cover. If you're super nerdy like me and you've actually read the waiver availability memo, there are 4 ESG waivers, but one of them really doesn't apply to the folks that are implementing programs, to you as providers. So we're just going to cover the 3 that you need to be concerned with. The first ESG waiver is specifically for ESG-funded homelessness prevention assistance. So this doesn't apply to other ESG-funded programs like rapid rehousing. This is specifically for those prevention programs. Generally, homelessness prevention programs have to reevaluate each participant's eligibility and need for assistance at least every 3 months. That's the typical requirement. This waiver allows you, when necessary, to do reevaluations of eligibility less frequently. So you don't have to do a 3-month reevaluation. You can do a 6-month reevaluation. You do still have to do those reevaluations at least every 6 months. This is for the time frame of 1 year from March 31st, which is the date of the waiver, to March 31st, 2 years, in fact, from March 31st, 2020 to March 31st, 2022. So this is the longest, I think, of the waivers that we've looked at so far. In terms of documentation, when you apply this waiver for a client, you do need to document reassessment of eligibility at least every 6 months. So that is still a requirement. And you, of course, want to have that note to file. The COC has also provided or will provide a form for this. I'm going to take us to that form just so you can see. Oh, actually, I'm jumping the gun. I'm going to take us back to our slide. That's not the form that we're going to share. This waiver form is going to be very similar to the forms we looked at before. All the forms look very similar, but there is one that is specific to this ESG waiver of reevaluations for prevention assistance. The next ESG waiver is going to look very familiar to you or sound very familiar to you if you were paying attention during the COC part. So this is a waiver of the housing stability case management requirement. If you're providing housing stability case management in any ESG funded program, this could be rapid rehousing, this could be homelessness prevention. Generally, those program participants that are receiving case management must meet with a case manager at least once a month. This is very similar to the requirement for COC-funded rapid rehousing of a monthly case management meeting. Like that COC requirement, HUD is allowing a waiver of the ESG monthly case management requirement. Again, I want to echo what Monica said. This is a challenging time for everybody, not least the clients that you're working with providing housing case management. So if it's possible, if you can keep that case management contact over phone, over video chat, if that's available, or in any way that you can, I know that you're going to be trying to do that. If that's not possible and you can't do that monthly case management check-in with your clients, then you do need to document the reasons why. This waiver is available between March 31st and May 31st, the exact same time frame as the COC case management waiver. And the documentation is also very similar. You need to include a note in the file, and we've provided or will provide the COC a form for this purpose. This is the form that I'm going to take us to now so that you can see what that looks like. Okay. So you can see that this form is specific to housing stability case management for the ESG program, specific to this waiver. We have our typical instructions. They just remind you in the situation or the case of this waiver, all you need to do is fill out this form and the justification for use of waiver section. There's no additional documentation required, so we haven't included a documentation checklist on this particular form. And then in terms of that explanation, there are a couple things that you're going to need to justify or explain. Both of these statements here must be checked. They must be true. First, you have to check that and explain why in-person case management is not possible, because we're not allowed to meet in person. Right? That's a good justification is the public health guidance that's in place at the time. Or even if you can get even more specific to this particular client is particularly vulnerable, we can't risk being meeting in person. Whatever the specific reason is for this client that you can't have that in-person case management meeting. And then you also need to explain why you couldn't do that over video or over the phone. This could be because the client doesn't have that technology or that technology is not reliable. The cost to the client of using that technology would be too great. And it's not something that you can ask the client to do. Whatever, or in this case, potentially even if you have severe staffing impacts from COVID-19 and you're not able to staff a monthly case management meeting for all clients, that might be part of an explanation here. And you'll notice that if you look at all of the forms, this form for ESG case management waiver is almost identical to the form for COC case management waiver, but you do want to use the one that applies to your program because there's specific references to ESG on this one. We've got a question about where these forms are available. Are the forms available on the COC website? I think it's very likely that they will be available on the COC website, though I haven't confirmed that specifically. We will definitely be sending them out to everybody who is registered for this webinar, and they definitely will be made available by the COC. So either on the website or over email, they will be available, and we'll follow up with everybody who's registered here in terms of where to find them. Okay. So the next waiver and the final waiver we're going to cover is a waiver of FMR restriction for ESG rental assistance funding. So if you have rental assistance funding, whether that's for a rapid rehousing program or a prevention program, typically you cannot use ESG rental assistance to on a unit where the total rent is above FMR. This, very similarly to the FMR waiver we looked at for COC, this waives the FMR restriction. So any program participant of rapid rehousing or prevention assistance who's entering into their own lease with a landlord during the waiver sort of window, if the lease is signed during that window, then it's okay for that unit to be above FMR. Again, this doesn't mean that you're going to get more program funding for that. So you really want to keep a close eye on your budget to make sure you're going to be able to continue supporting all of the units that your participants are moving into. And again, it's also important to note, this is a waiver of the FMR requirement, not the rent reasonableness requirement. So these ESG funded units do still need to be rent reasonable. The window for this waiver should be very familiar to you. This is our typical 6-month waiver between March 31st and September 30th. And in terms of documentation, just like for the COC FMR waiver, you really want to make sure you have a copy of the lease with the date that it was executed so you can demonstrate that, yes, this lease is in the appropriate window. You want to have that completed rent reasonableness analysis, as you always do. And you want to include that note to file. That's ideally the COC form that's filled out completely that documents the date of the waiver memo, the date and which waiver you're applying, and then that justification or explanation for why the waiver is required. This concludes our coverage of the COC and ESG waivers. And I'm gonna hang out and riff a little bit while I see if there are any more questions in the chat box. But if you have questions after the webinar, or if your colleagues have questions, we are available to you for exactly this purpose. You can
Eli, this is Monica. It sounds like your audio cut out.
contact us at Santa Clara. Okay, so Monica, can you hear me now?
I can hear you now. And I think
Awesome.
what you were mentioning when it cut out was that folks are welcome to contact us at the email on your screen, Santa Clara COC at homebaseccc.org, if there are any questions.
That's exactly it. And I'm not seeing any more questions coming in on the chat. So I'm gonna thank you all so much for joining us today. And thank you so much for the work that you do during this time and all the time for your community. We are thinking about you, and we really, really value the work that you're doing. So thank you so much for that. And please reach out if you have any other questions.